Healthy West Australians are being warned against using face masks to protect themselves against coronavirus.
The state government's advice in line with the World Health Organisation. Unless you have symptoms of COVID-19, don't wear one.
But general mask wearing probably won't help because what's needed is the sophisticated N95 mask, the one in short supply for frontline medical staff.
The N95 mask has adequate filtration for viruses. If you wear a surgical mask, that doesn't provide adequate protection.
Right now, the CDC is saying masks should only be worn if you're sick or you're taking care of someone who is.
And the fundamentals are not rocket science. It's universal wearing of masks.
We put surgical masks on sick people to protect healthy people around them. They serve an emotional or psychological benefit for people because people feel more protected. The reality is they don't really provide us with protection. So there are basically two types of masks. There's surgical masks and there are masks called N95 respirators. Let's start with surgical masks. In a hospital setting, I'm a surgeon, I do real surgery. When I go into the operating room and I put a surgical mask on, it is not to protect myself from getting sick in a sterile environment. It is to protect the patient that I'm operating on in case I spit while I'm talking or cough or sneeze. Surgical masks that you see all over television and video, they do not block out the tiny particle size of coronaviruses or influenza virus. They don't. Those viruses can pretty much go right through those masks. Now you would ask, well then why, if you're sick, do those masks do anything? Simply as a barrier. It could be a plastic wall, it could be a scarf, but masks are just convenient to give to a patient if they're coughing or sneezing. Then you go to the N95 respirator. There are a bunch of different models. They come in different sizes, different shapes. Those are for healthcare providers when they are taking care of a sick person with a high impact respiratory pathogen. They're called N95s because they block out 95% of viral particles. You have to be fit tested for those masks, a specialized process. If you're not, they can actually also do more harm than good. They also have to be worn a certain way. They're single use only, so when they start to get wet, which generally happens in about a half an hour, people need to change them. So those are for healthcare providers when they're taking care of a patient with known or suspected infectious respiratory disease. I totally get that people feel more comfortable if they have a mask on, but the science just doesn't support that.